Hello, my name is Dr. Eduardo Lopez. I've been working for Dr. Ben-Zur for 3 years. We're trying to make this little video as an educational tool for other foreign doctors and other office staff, so they learn a little bit about manners, how to interview patients, how to interact with people. So I'd like to make this simple and something that you can enjoy in a brief period of time. Basically, I always admire the way Dr. Ben-Zur, his bedside manners, and I always took his advice when he told me that first, bedside manners comes first and then medicine comes after. So I want you guys to understand that the importance of this concept. It is critical when you're interacting with people that you show respect. That's probably the most important, the most critical component of interacting with patients is showing respect. So always, no matter how the patient is, angry, happy, talkative, whatever it is the case, you need to show respect and enthusiasm. So I'm going to try to make a little description in my mind. I'm going to make like a interview, and I hope you guys understand what I'm trying to say. So basically, always knock on the doors. Wait for the patient to invite you. Don't open the door without being invited. That's rude, and it's actually something that we always try to avoid in the practice. So when you enter the room, have the patient to sit in the exam table. This is important. Dr. Ben-Zur is going to come to examine the patient, and he prefers that the patient is sitting in the exam table when he comes in the room. Always, if you don't say, I have a nice advice that I always give to all my other colleagues. If you don't say thank you 10 times during an interview, you're not saying it enough. So you have to say thank you every time the patient tells you something. If you're inviting the patient to move from the chair to the exam table, always thank the patient. Be very polite. Use your manners. Would you like to please? Can you please follow me? Can you lay down? All these little things make a difference. One important advice that I can give you is learn about the patient's medical problems. If you go into the room and if you look like an idiot, they're going to take you like an idiot. And remember, there is not a second chance for a first impression. So you guys are in front of the patients. You totally have 5 minutes or 10 minutes of this person's time, and you can ask whatever you want. And I want you guys to understand two things when you go into the room. First, that you have to make the patient love you. You have two missions when you go into the room. The first one is the patient needs to love you, and the second one is that you need to be accurate. And we're going to concentrate in the little points of how to be accurate when you're interacting with the patient in 1 minute. Again, I want to get my point across. You have to be super polite to succeed in this profession. No matter if you had a rough day in your life, your life at home, whatever is not going well, in the office you need to be perfect. And the patients are going to sense that. And they're not here to hear your problems, they're here for us to take care of them. So you have to believe it, feel it, and you have to show that medicine is your passion. This is the key to be successful in medicine. So when you're with the patient, we have different kind of situations where the patient can be basically having different kinds of symptoms. They can feel right, they can feel wrong, they can feel multiple things, but it is your mission that you obtain information. We have established a protocol. Basically, we work with computers, as you know. And the way to know what's going on is that you go to the previously signed note. The last time the patient was in the office, Dr. Ben-Zur did a note. He signed off on that note. You need to read that note before you go into the room. You know what's going on. You ask the patient if they did the medicine changes as instructed by Dr. Ben-Zur. And you always want to find out what's going on. How do you feel? Are you feeling better? Are you having any of the possible side effects of the medicines that he gave you? Are you having new complaints? And always remember, there is a mnemonic that I need you guys to memorize. It's called Liquor AAA. You're gonna find it in my notes. This video goes along with the note that I'm writing, but there is a mnemonic called Liquor AAA. You always need to implement that when you're talking to the patient. L stands for location. I stands for intensity. Q stands for quality, onset, and duration. The O stands for the onset of the symptoms. The R stands for radiation. A for aggravating factors, A for alleviating factors, and the other A for associated symptoms. Chest pain. You need to know, is this a new complaint? Is it something that has been going on for a while? Or this is relatively new? I mean, it's a totally different story. You need to define the pattern. Is this unstable angina? This is stable angina? This is a typical chest pain, unlikely from cardiac origin. So it's very important. I want you guys to realize that we're here to assist Dr. Ben-Zur. You need to be accurate, and you need to know what's going on with the patient. If you don't tell Dr. Ben-Zur what's going on, he may send the patient with unstable angina home. So I want you guys to realize how delicate your job is. So when you're with the patient, the most important thing is this something new or I've had it before? Is it getting better, worse, or is it about the same? Is your shortness of breath better, worse, or is it about the same? So that is a critical component of the HPI. And I need you guys to concentrate when you're doing every symptom that the patient complains of. You are required to do the liquor AAA. So please have that in mind. We also want to obtain some information when the patient is here in terms of blood pressure and sugar readings. If the patient has high blood pressure, we always expect that people check blood pressures at home. We also want to obtain sugar readings if the patient is diabetic. We also need to know about the exercise patterns with the dietary habits is very important. We need to know how they're taking the Coumadin, what the last INR level was. This is a very important component that we'll talk in detail in the future, but you need to know when you present the patient to Dr. Ben-Zur, you need to know what's going on with the INR. You need to ask the patient about smoking. If the patient has been a smoker, it's always a good habit to ask the patient, are you smoking or do you currently smoke? And you need to, when you're presenting, you need to tell Dr. Ben-Zur what changes we did the last time. That's another important part. Basically, the past medical history, the past surgical history, those are topics that are already in the chart. You don't need to update it unless there's something new, like a procedure, like a surgery that the patient had done. You are required to document those things in order to keep the database updated. Medications is a critical component. Most patients hate when you ask them, give me 1 minute, I'm going to ask you the medication. They're always going to say, again, it's in my chart. I don't want to tell you that. They probably don't realize that we have electronic medical records. So just take 1 minute. Explain that to the patient. They will understand. They will calm down. Tell them, Mr. Jones, I need to ask you this medication really quick. It's going to take us 1 minute. Again, I don't want to do this. This is a very important part of my job and I need to do it. It's going to take us 1 minute, please. Most people are going to be okay with that. When you go to Dr. Ben-Zur, make sure that you know exactly what the patients are taking. It's very important you guys understand that you're working in cardiology. You're not working in another kind of practice where interactions between medicines, dosages are critical. We can kill somebody if we don't give them the right dosages. And Dr. Ben-Zur needs accuracy. One advice that I can give you, if you made a mistake, you forgot to ask a medication, you're not sure, please don't tell Dr. Ben-Zur that you ask or tell him wrong information. You're gonna get things worse, and obviously we care about the patient. We don't care about what's gonna happen. Different than the patient's care. So please, if you didn't ask the medications or you're not sure, tell Dr. Ben-Zur. Go back in the room, re-interrogate the patient, and go back to Dr. Ben-Zur and tell him this is what he's taking. This is what he's not taking at this point. So make sure that you document medications very, very correctly. That's a critical component of your job description. We'd like to have in terms of documentation, we'd like to have initiation dates, discontinuation dates, and try to be as accurate as possible in terms of when does the patient take the medication. POQPN, POQIM, POQHS, PRN, POQ week. I mean, all those concepts are very important in terms of documentation. We need you guys to do that in order to keep the electronic database accurate. We also want to update the allergy section. Remember, if the patient's here, let's say that the patient is taking an ARB or an ACE inhibitor, they develop a cough, and we realize that when they're in the office. Dr. Ben-Zur probably won't tell you, can you please update the intolerance section to Kaiser, 50 milligrams POQD cause cough, but you're supposed to know these kind of things. So please, if you know that we're changing medication, given a possible interaction or intolerance, do it right away. Update the intolerance section, because if you wait for the next time that the patient comes to the office, you're most likely gonna forget about it. And this is an important part of the EMR. When we have computers, makes our lives easier and improves the patient's care. In 2 years, 3 years, if we're going to use an ARB or an ACE inhibitor, we know for sure that the patient had a cough, and we won't make that mistake. So please do it. It's another critical component of the note creation. Review. Well, the family history, you don't need to change anything unless there's something going on. The mother passed away or the father passed away. Who knows? So that part of information you don't normally update unless there's something that needs to be changed. When you go to the review of systems, I need you guys to concentrate on a very accurate review of system. When you're interacting with the patient, we expect that you ask all the questions. You not only ask the 5 cardinal cardiac complaints, which are chest pain, shortness of breath, palpitations, dizziness, or syncope, but you also need to ask multiple other things like energy level, like joint pains, muscle pains, dry cough, constipation, swelling of your legs, any blood in the stool. This is very important. Remember, most of our patients, they take in combination of antiplatelet agents, aspirin, Plavix, Coumadin. All these things can lead to severe side effects. So please have that in mind and make a very thorough review system. When you present to Dr. Ben-Zur, have that in mind. This is another important part of your job description. Blood pressures. Vitals. Basically, in the office, we only check pulses, and we want to document respiratory rates for billing purposes, and we want to document orthostatic blood pressures. The orthostatic blood pressures are a critical component. Most of our patients are taking a combination of pills, most likely alpha blockers or diuretics, and we can be over-medicating patients if we don't check orthostatics. So the correct way to check orthostatics is that you first have the patient lay down, you have the patient relax for a minute, check blood pressure laying down, and then you check blood pressure standing. If there is a difference between 10 points, if your blood pressure goes down more than 10 points in the systolic blood pressure number, or if your pulse goes up more than 10 points, we consider that to be orthostatic hypotension. We got to be careful. Our experience working with patients shows that people with orthostatic changes in their blood pressure, they're prone to have syncope, dizziness, get into car accidents. So it is an important part. So always check orthostatic blood pressure when you're interacting with the patients. Physical exams, we don't do. Dr. Ben-Zur is responsible for that. However, he's going to tell you briefly what's going on with the patient. Make sure that you always change the general appearance. If the patient is morbidly obese, you need to document that. The default template is not going to say that, but you need to update the general appearance section. If the patient is using a walker, or if it's a wheelchair-bounded patient, you need to document those things. The neurological exam, obviously, if your status post-CVA is not going to be normal, so we need you guys to document the findings on the neurological exam. If the patient has severe rheumatoid arthritis or any other musculoskeletal disorders that are grossly evident, please document those things in the physical exam section. Dr. Ben-Zur won't tell you that, but we expect that you guys do those changes, and obviously keep it every time the patient comes. The note has to make sense. Imagine how it's going to look. We don't need any garbage data, but imagine if we send that note to another doctor and we have a patient on a wheelchair and the neurological exam says perfectly normal. It's not professional. So please make sure that you guys update those records accordingly. Cardiology exam, Dr. Ben-Zur is probably going to tell you 2/6 systolic or 2/4 diastolic murmur, or S3 gallop, or whatever, ICD site, healing well, all these little things, but make sure that you document those things in the charts. When we go to the diagnostic data section, that is also a very important part, not only for the patient's care, but for billing. We have to be very accurate, in terms of indications, in terms of what's the diagnosis, that the data is correct, particularly with the stress test. Stress test is not a perfect test to determine if the patient has coronary disease or not. However, it depends on documentation from the most part. It can either be an inconclusive exercise stress test, It can either be a low probability or it can be an abnormal exercise stress test. And you need to make sure that the data is accurate. Most of the time, other people is entering the stress test, but when you're going over the note, make sure that information makes sense from the beginning till the end. When you're doing the assessment, always try to be very accurate. We expect that you guys know that irrelevant diagnosis, to take them out of the assessment. Let's say that left shoulder pain a year ago, that is no longer relevant. We expect that you guys update the database and take off those pieces of information that are no longer relevant. When you are documenting things, remember, medicine in the United States is very documentation oriented. So it is critical that if a patient is having chest pain, you need to document what you're doing. Is a typical chest pain, low probability exercise, stress test on this date, unlikely from a cardiac origin, patient instructed to call me immediately if symptom recurs or if the pattern of the symptom worsens. All these little things needs to be stated in the note. So documentation is critical. Don't just say chest pain, minimally symptomatic. That's not a diagnosis. It's either chest pain. Did you work it up? Have you worked it up? What are you going to do with the chest pain? Are you going to send the patient to a cath? Are you going to send the patient to have an adenosine cardiolite nuclear study? So we need to know all these little things. So the note needs to make sense from the beginning till the end. When you're documenting the plan, it also has to make sense. Remember that the plan is an important part of the note, because next time that the patient's here, we're going to know what's going on with the patient based on the plan. So try to always do the first 2 lines of the plan to document the changes in the medications in those 2 portions. So if we change medicines, if we instructed the patient to obtain a consultation or a test, try to document those things in the top 2 lines of the plan. I think that's pretty much it. But remember, the most important thing is that you document things carefully. Documentation is one thing, practicing medicine is another thing. But remember, the most important thing that I want to get my point across in this video is that bedside manners are the most important component of your interaction with the patient. You need you need to have them love you, and you need to be accurate. So have that in mind.